A mental health support team is a fairly new service in schools. We work with young people who've got emerging mental health difficulties, some worry, some anxiety, some low mood, and we try and catch it early before it becomes a real problem for that young person and starts to really impact on what's going on in their lives. Education mental health practitioners and senior practitioners who go into schools from primary school up to college age, and they support children either one-to-one or do like some workshops and things like that. But we also support parents of younger children through parent-led interventions, or support the school with a whole school approach.
So one of our pupils that have really benefited from having the MHST support is Sam.
The reason why I got Julie was because I started to notice my mood was very low, and when I went out I felt really insecure. I used to go out and then feel like I had to quickly go straight home, and that's when I started to hide myself.
She'd recognised herself that she needed some support. Along came the MHST.
Julie's a lovely person who works for the mental health support team. I went to meet Julie the first time. I did have a few nerves, and as soon as I opened that door, it was such a welcome feeling. You just realise you can just open up about stuff.
Sam and I worked on a worry management intervention which involves young people kind of really understanding anxiety. She was really engaged in all the sessions. She always came along kind of with lots of information to share about how things had been going for her.
I used to do a diary. When you sit and reflect on your whole kind of mood and why it was, you start to realise that it does become a little pattern. I used to write all my worries down, and I used to scrumple a piece of paper up and I used to just rip it, and that whole ripping just brings such a weight off your shoulders. I used to go to a lot of friends about it, and there was so much support from them.
As well as working with the young person, we try and involve the family as much as possible, because it's really important with the CBT type of work we do that the young people practice things outside the sessions, so that's where the real change happens. If they still need some extra support and that's maybe not from us, that's when we would maybe look at signposting them and working with other professionals.
I've finished the process with Julie now. The things that Julie have given me have helped me so much.
Now that she really understands where these feelings come from, why she's experiencing the feelings that she is, she can manage it much better, and it's given her the confidence to think, actually, I'm not going to avoid this situation anymore.
And I think staff have seen a really big change in her. There's still the difficult days, but she uses the coping strategies, but she's certainly made huge strides since having the service.
I think the fact that we're based in the school makes building that relationship much easier.
So there's a real link between mental health and education.
Obviously, if you're not in a good place emotionally, it's really difficult to learn, because obviously you're distracted by your feelings and your emotions. So if we can kind of support schools to support young people, hopefully we can help young people to really understand and manage and maintain their own mental health.
From a school's perspective of having a mental health support team within the school, you link to the NHS, you link to other services, to see the difference it's made in our academy, and for our young people to really benefit from that, it's just been fantastic.